I'm Laura Chandler, and today I'm joined by the co founders of Empowered Endings, Bob and Elizabeth Uslander. Bob is a medical doctor, and Elizabeth is a social worker and spiritual counselor. And together they formed Empowered Endings to help people and their families facing complex and terminal end of life issues navigate their end of life care with consciousness and compassion. Welcome.
Thank you, Laura.
Thank you.
And thanks for being here. I'm really looking forward to having this conversation today about empowered endings. And I'm excited about what you guys are doing with your model. And really, it's bridging some gaps that I think we have in end of life care and is bringing a holistic sort of approach to taking care of people as they come to the end of life. And can we start by just talking a little bit about how you came to form Empowered Endings? What inspired this?
Sure. So, both of us worked in healthcare. Bob was an emergency physician for 25 years and then went into palliative and hospice care. And I, through a much longer and windier road, ended up as a hospice social worker, bereavement counselor, and volunteer coordinator. And in our experiences in those spaces, we separately, before we met, identified some substantial gaps, as you said, in care. And in 2016, Bob started his private practice to provide geriatric palliative and end of life care. And then shortly thereafter, we met. And the combination of his medical experience and desire to provide really quality holistic care, and my psychospiritual experience and similar desire to provide education and agency in these end of life spaces. And both of our commitment, really not just to patients, but also to their families and to collaborating providers, started the journey of the practice, the medical practice, where we offer care and counseling in these spaces. And after a number of years of experiencing incredible transformational journeys with hundreds and hundreds of families, we realized that we were perhaps onto something really important. So we started to really examine what we were doing that was making a difference and how and why. And we started to systematize the practice and started to build the institute where we have been building community resources and offering education to other people, healthcare professionals, community members, care planners, people who are just interested in exploring, coming together and sharing their experiences, their questions, their curiosities, and ours.
Great. Bob, do you have anything you'd like to add to that?
Well, I guess from my perspective, as an ER doctor for 25 years, I saw um, so many people struggling through their end of life journeys. People would end up in the emergency room when they shouldn't have because no one really knew what to do and they didn't have appropriate support. There were people coming in who were being treated aggressively for things that if they had been able to have appropriate conversations in advance, they would have with people who could have helped them create a plan that was more aligned with their values and who they are. Things wouldn't have gotten to the point that they did. Um, and I it was just over time, it became very apparent that we were just really doing a lousy job of taking care of people at the end of their lives. Um, Not universally, but far too often. And I had a personal experience with a dear friend of mine who died at the age of 32 from an aggressive form of melanoma. And in supporting my friend Darren and his family through that journey, I was able to experience a different way for an end of life journey to unfold and help to coordinate and orchestrate a really beautiful final chapter for him. And that was planted a seed for me that eventually I got to the point where I felt um, inspired enough and motivated enough to actually make put a stake in the ground and say, this needs to happen. We need to be able to do this for more people. And, and so started the practice, and shortly thereafter, Elizabeth came in to my life, and we together have really infused much more into what I had sort of envisioned, and empowered endings is the out the output of that, the outcome of our combined visions and our combined passions, and something that neither of us could have done alone. Uh, and it was just kind of fortuitous and really fortunate that we came together and have been able to build this, because it's making a huge impact on a lot of lives.
Yeah. I can imagine. And can you talk a little bit more about what you found, what you both found missing from kind of the approach to end of life and end of life care?
As a social worker, one of the things that I was so devastated by was, patients not having a relationship with their physicians. So most of the time when people go on hospice, there's a medical director who's not intimately engaged with the patients and families. And while hospice staff, the nurses and social workers and aides and counselors, they're all wonderful, but there's something different about having a physician with their level of knowledge and experience in medical care and in life, that when you have the attention of a doctor exploring, getting to know who you are and exploring what your values are and what your wishes are, and allowing that to inform full care plan and the whole team, there's something very different about the experience when that happens. And one of the other things that I noticed that was really challenging, I got so tired of people falling through the cracks with their desire to have agency and dignity and options, and the limitation either of organizations not participating in supporting people in all of their legal options, or not having the financial wherewithal to provide holistic options that might have really improved people's quality of life and helped to make their experiences more peaceful, and in particular, empowered through the end of life options that are legal in California. So those were three of the things that stood out to me as really unfortunate gaps in care that could be, I think, if the system were different, or if we had more support outside of the system, really well provided for.
Mhm.
And those are some of the really important gaps, and there's others. And one of the things that is striking for me is I can't tell you how often we hear that people say that we take better care of our pets than we do of our people.
Mm.
And people know that when you have a pet, a beloved pet, and it gets old or it gets ill and it's suffering, it's no longer able to thrive or live in a way that it seems like there's adequate quality in that animal's life, that it's a natural thing to get the support of a vet and allow it to have a gentle and compassionate and death. And we don't do that for people. I mean, granted, like the options available, and the human experience is a little more complex than it is for the pets, but that doesn't mean that we don't deserve the same dignity and compassion. So we are very focused on helping to kind of reverse that, to turn to put an end to that belief that we don't treat our people with the kind of dignity and respect that we do for our pets. And we can't not we can't necessarily care for everybody, but we can care for a everyone that we take care of. We can make sure that they feel that they have the honor and the dignity and the agency, and that their families have the support and the compassion, and that we can help to be part of a movement where more and more people understand what's necessary, what needs to be put in place, the conversations that need to happen to ensure that as a person's life is coming to a point where quality of life is no longer acceptable and they're struggling, that they have the option to have a gentle, easy, what we like to call a soft landing.
Mm, mm. I love the idea of a movement, and I think you are part of that, and, some of the problems I'm sure that you and that we encounter just culturally is that, talking about death and end of life is not, uh, it's not a popular subject, and it's one that we tend to skirt, many of us, and, what I'm hearing from you is that you're, you know, encouraging that conversation and making that helping make that more a part of the conversation, that we have with ourselves and with our loved ones. How do you broach that subject with folks, or how do you deal with the cultural tendency not to, talk about death?
Well, we honor it, right? We honor each individual's experience, and what comes to mind as you're talking about that is one of the ways that I think we're more successful is that we take a light approach to it, right? Granted, it can be a challenging topic for people and could be emotional, but we like to approach things with a certain amount of levity and bring humor and joy into the atmosphere in the conversations. So when we go out and we give talks in libraries or community centers or different organizations, we recognize and we kind of deal with things head on. Yes, we're all dying. We're all going to this place where we can't deny that. I guess you can for a certain amount of time, but we try to honor each individual's perspective on it and find ways to, where there's a chink in the armor, we kind of focus and head in there and, um, what we're not trying to convince people that are opposed to this conversation to have the conversation. What we're
Mhm,
trying to do is make it available to the people who are open to it, and then maybe people that are on the fence that, like, maybe we can help to sway them if we can make it feel a little bit more comfortable and a little bit more available to get them on this side of it. And then maybe over time, the people who are over there will find their way. There's some people who won't take their dog to a vet to be euthanized. They'll just kind of let them struggle and, die the natural way at home.
mhm.
Um, Not everyone's gonna approach this the way that we feel is the healthiest and most beneficial, but we're trying to, we're not trying to tell people they're doing it wrong. We just wanna make it available, what's available, for the people who are open to it. Do you have
Yeah.
anything you wanna add to that?
Yeah, well, I think importantly what you said is we have no agenda. So there are people who are not going to be comfortable with these conversations, and that's okay too. It might be helpful to them and their families if they became open to it, but not everybody is going to, and that's okay. I think one of the other things that's helpful is helping people understand the context of this through parallels. So, one of the parallels that I love to talk about because it really hits a lot of notes with people who are wondering about this is the birthing movement. So, a long time ago, birthing was a home based experience with a family, and as we all still know, it takes a village to raise a baby. So, at some point, then it became a medicalized journey, and there was, only an OB and a pregnant woman in a hospital, and that was the only option available. And then people started to reconnect with holistic birth and reconnect with the notion of home birth and reconnect with the idea that there are options, there are different ways of doing this. And now you can do whatever kind of birth you want. You can have a hospital birth if that's what your preference is. You can have a home birth. You can go to a birthing center. People can have their whole birthing journey guided by doulas and midwives with doctors minimally involved simply to ensure the safety of the mother and child. So, in the same way, end of life care used to be a home based family experience. And then it's become, over the years, a very medicalized experience. Most people die in hospitals. Now we have hospice, which is great. People can be at home and get care at home. But hospice hasn't changed in the decades that it's been around, and life certainly has, and the movement that we're talking about exists already. There are death
Mm,
doulas internationally. There are people hosting death cafes and death overdrafts, and there are so many more people who are open to communicating about it that the culture is now changing. And the invitation, I think, that we are experiencing the calling towards is to help facilitate that holistic experience being more broadly available to help people who don't just want to go into the hospital and have the sort of default treatment, but who do want to be empowered with different options, who may want to be at home with really high levels of, alternative care. These are things that would be wonderful to have normalized and ultimately to have places that people can go and do it the way that they want to, as opposed to, again, just the default mode that's otherwise available.
mm. Yeah, I love that, and the 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 name of your organization, Empowered Endings, I think just implied in that the idea of being empowered at the end of your life, having choice is so important, as you said, no matter what choice you make. And what kinds of resources do you bring to the end of life process? What offerings do you have for people to help them in making those choices?
What do you need? We kinda got it. So, we initially the practice, when it started in 2016, it was really as Elizabeth mentioned, it was designed to bring a holistic experience to people that was not to replace what was already available through the traditional model, but to enhance it and supplement it. So, um, in addition to direct medical care and having a physician who's engaged, highly engaged with each patient and family, I should say that a lot of what we do, a lot of the service that we provide is really geared towards taking care of the family. The patient is, of course, needs to be cared for and their needs met. And there's a whole host of different things that go into that. But one of the things that we recognize is that families don't have support and they don't have um, guides to navigate them through the journey. They're expected to figure it out on their own. Even when people go on hospice care, for the most part, the family is responsible for providing the care. Hospice is there to provide some occasional visits and medications and things, but the day-to-day, hour-to-hour care is still on the shoulders of the families. And having a team of people, a doctor, a nurse, a doula, a social worker, people who are engaged and caring and available and responsive, that's the key. That's the key to the experience, um, going smoothly and the loved ones after their loved one dies, having the kind of grief that is healthy, and not traumatizing and complicated. So medical care, mm, sort of companionship and support so that there's somebody walking along with the person. Sometimes they need a little bit of support and they just need a guide who can point out the paths and just be there and available to keep them on the right path. Sometimes they need somebody like a Sherpa to like carry the load and to help, bring them along and give them the sustenance they need to get to the peak. Um, and I think part of it is each family and each patient needs something different. So the medical care, the doula companionship, the nursing support, the social work, orchestrating, bringing in appropriate caregivers or appropriate nurses that can help people as they're needing higher levels of support. Massage therapy, acupuncture, physical therapy, providing alternative medications like cannabis for people who are open to and would benefit from that. So meeting people where they are, being creative in terms of what we'll provide, and not being limited by what insurance will authorize or pay for, and just being committed to showing up every time, time and again. I think that's the core of
Yeah,
it.
that's beautiful. Elizabeth, anything you would add to that?
Meeting people where they are, creating options, and showing up is pretty much the gist of it. I think that's great.
Yeah, and, meeting people where they are is what we need in any aspect of the medical, um, experience, and compassion, having a compassionate caregiver, a compassionate doctor, and, just hearing you talk, I just think of how compartmentalized we've become in the medical field, in the care that we give people, both at end of life and throughout life. It just becomes more and more compartmentalized, and, there's positives to having expertise and, in certain areas, but you really lose something when people aren't communicating and they're not, including the patient as, um, their needs and their wants
Mhm.
in that
Yeah.
in that model, so it's refreshing to
Yeah,
hear
in
that.
our healthcare system, so often people are just pushed down a path. They're like it's like they get on this conveyor belt and they're just on it. Often, doctors tell them they make orders, and the patients as well. They tell them what they're going to do, and the patients often don't realize that they have choice. They have the ability to question and get additional guidance and additional input. So it's in general, it's not a partnership.
Mhm,
It's very paternalistic. It's not a partnership.
mhm.
Physicians and healthcare providers need to be partnering with patients and families, and then they need to be willing to collaborate with everyone else who's part of this village of support and care.
And I
Yeah.
think one of the most important things that's also lost from the medical system is the healing power of connection.
Mm,
There's curative healing, and then there's just healing. And when you're in an end of life journey where you have a terminal illness that isn't curable, the healing doesn't come from all of the different treatments that would ostensibly cure something that's incurable.
mhm,
It comes from the experiences that you have. And
mm,
experiences need to be grounded in that connective partnership. They need to be grounded in being seen and being supported in whatever your journey is. And I think that's one of the things that is so devastatingly missing from medical care is it's so much about doing things and so little about being together. And that's one of the things that's so beautiful about practice that we have and the work that we've been doing is the opportunity to just be with people and to really come to understand where they are and where they want to go and do whatever we can to support them in that journey.
I'm so glad you mentioned that because it's the human connection is so important, and you're reminding me of a conversation I was just having with a friend of mine who is a former monk and, the Dalai Lama's, primary English translator, Thupten Jinpa, who does a lot of work in the Compassion Institute and these different programs, and we were talking about this, the very thing of how important human connection is in the healing process. And yeah, we lose that. And so, and how effective, like how effective we can be, and with all of the great strides we've made in healing, and curing diseases, and with different things that are so helpful. When we bring this back in full force, what a powerful, medicine it is.
And I'd like to expand on the concept of connection because we've seen how transformational it is for the connection and in the patients in their experience.
Mhm,
We have testimonials from patients whose lives have been like incredibly enriched, not because of the medical care they're getting. Sometimes the medical care is really important and helpful and prolongs their life and gives them, more chances. But through that, the connection with other caring humans is what makes their day-to-day experience worthwhile and inspiring. but the connection is also critically important for the people who are providing care,
Yeah.
both the family caregivers as well as the professionals. There are so many people who are involved in end of life care or palliative care or critical care, emergency care, who are experiencing a lot of moral injury, because they can't provide what they signed up for, right? That's
Mm,
the healthcare system is so stifling and it is so limiting in so many ways that people are experiencing this soul angst
mm,
at at seeing what's happening. ER doctors, ER nurses, critical care people, hospice staff. And so our community is providing the connection for people who want to show up and be part of a community of people, a tribe of people who get it and are wanting to come together to collaborate to create a, a better possibility, a better future around
mm,
healthcare and not just end of life care, but that's sort of right now where we're primarily focused because so much of it comes to bear in that space.
mm,
And so I really encourage people to connect with our community because that's going to be a healing space for the providers, both professionals as well as families who are in this space and trying to support loved ones through a challenging journey.
mm, mm. You made me think too of, like, the need of and not to take this too off on a tangent, but the need of the healthcare providers, the death doulas, the people who are offering support, for them to have the support and, yeah, to have support and be recognized for, the intensity of the work that they do, and, how do you help them, or what's your perspective on that?
Well, one of the things is the culture of our team. We don't just talk about partnership and don't just do it with the patients and families, but we really support each other, and that's very important. Our individual and collective values are really the foundation for not just the work that we do, but the way that we do it.
Mhm,
And that's what we're bringing to the community, the online community that we're building. Um, Being able to provide resources so that people can find more information, being able to provide a forum for exploration and connection, being able to provide platform for people to share their voice and voice their expertise, their wisdom, and draw in other people that are in similar understandings or similar positions. So so grounded in the values of partnership and the work that we do and expanding into as many communities as we can. So we have care partners in Cleveland, Ohio, and in Florida, and in Texas, and people in Australia, and in England, and in Canada. There are people from all over the world who are coming together to support each other in this expansive movement. And our goal is to just create a space where that is something that everyone knows they can find no matter where they are.
that's great. And you've just launched the, institute. You were talking about, we were talking about before we came on, the Institute of Empowered, Endings. And did you want to say a little bit more about that? I know it's a place for resources and, anything else?
Sure. So, the Empowered Endings Institute can be found on our website. The goal of the Institute is basically what we were just describing, to create a platform for people to come together in connection and community, to share their wisdom and experience, to offer education and resources. And so on there, you can learn all about our values and approach in the medical group. You can learn about the Institute and where we're speaking. You can learn about the foundation that we also have. We established a foundation to ensure that financial burden is never an obstacle to people getting the care that they need and deserve. And so we're working to build the philanthropic base for that so that we can offer more. Right now we have free support groups and we're building out a hospice hotline and hopefully just more and more opportunities to provide services to underserved and low income populations.
Oh, that's great to hear. That's great to hear. And, I have this, your brochure. It's just you're really impressive. I mean, just so comprehensive and, so needed. And, you both have been in this field in different ways for a long time, and you founded this in 2016. Have you seen a shift in your years of, being in the medical industry and in social work and hospice care? Have you seen a shift in kind of openness, or where have we come? How far have we come, and how far do we have to go?
Well, so I've seen a shift. I've been doing this for a long time, and, I graduated medical school in 1988, and so in that time, in some spaces, I've seen quite significant shifts, and in others, it seems still we're pretty archaic.
Mhm,
Um, fortunately, so we live in California, and we practice in California, and in 2016, California passed the End of Life Option Act, which, was modeled after the Death with Dignity, law in Oregon, which passed in 25, 28 years ago, and a similar law in Washington State, which allows people who are terminally ill with a life expectancy of less than 6 months and competent to make decisions, the ability to go through a process and get a prescription for medication that would allow them to go to sleep and gently, die, within a matter of hours. So it's similar to the experience of taking, your pet to get a gentle, dignified end of life
mhm,
experience. People now have the ability to do that at a time and place and with the people of their choosing when they qualify for this. So that's a big step forward in my mind, in our mind. It's not something that we necessarily encourage people to do, but we make sure that they understand when it's an option that's available to them, and we think everybody should have the information. I just read a study that said that only 25% of people in California are aware that this law exists,
mm,
which 75% of people, including those people who are terminally ill and suffering and would, readily choose to limit their suffering to what's acceptable to them. They don't know about it and they don't have the option. So, um, I I think that one of our, the work for all of us is to help provide people with the information that gives them access to the options that they would want a bit, to choose. I see a lot more, and it may be because I'm paying more attention. I'm steeped in all of this work, but I certainly am seeing more written in major media outlets, New York Times, Washington Post, and on the news about end of life issues. Um, and currently, for example, medical aid in dying, the end of life option, there are now 10 states and the District of Columbia that have laws that allow this. And there's legislation pending and referendums pending in a number of other states. So from this regard, thanks in some part to compassion and choices and advocacy groups and people like us, um, people are getting more options and they're having more conversations about what's possible and how we can have more choice and more dignity through the end of life journey. So we still have a lot of work to do, but I do see that there's positive movement happening.
mm,
I think too, one of the key things that's still missing, death doulas, there are more and more and more of them, have no way yet of being integrated into medical care.
mm,
So you can't bill for them. It's something that you may or may not be able to find in your community, and they don't have a mechanism by which they can partner with the clinical care that is provided, except to serve as hospice volunteers.
mm,
And that is one of the things that I think that's really important to us is helping doulas to integrate into the medical system. So in our practice, Bob, as the physician, partners with doulas,
mhm,
provide that wraparound care and companionship. And doulas can come from all kinds of different places. So we've got doulas who have been hospice nurses for decades, doulas who have been music therapists or grief coaches or social workers and spiritual counselors. Everybody brings something different to the table, and every family needs something different. And so being able to design the care plan and partnership that works really well for each patient and family is something that is definitely missing still from the system, that personalized wraparound care. And I think even beyond that, we really have a vision of people having a safe space to go where they can learn about all of their options and where they can engage them. So, having a place where someone could have the death of their dreams is something that I think ultimately will be a possibility. And that's something that we would like to support happen, to create spaces where people can do it their way, whatever their way is within obviously the law.
Mhm.
But making sure that the right resources and support and education are available to everyone is something that we have a certainly a long way to get to, but that's happening. It's starting to happen.
Mm. Wow. I'm excited, like, talking to you. I feel like a kind of a relief that there are people who are knowledgeable, and I know that there are more people out there and that this is happening, but it's so, uh, it's so needed, and it's like there are these little islands of it, and I wish you all the best in making them larger land masses. That
Right.
bringing this forward. It's so important. And I know you have a book, you're working on a book. I don't know when that's gonna be out, but I think that's gonna serve the purpose in helping forward all of this. And, and I'd love to have you back when that's out and to continue this conversation. Anything else you would like for people to know? I mean, they can contact you. It sounds like they can get a lot of information from your website and can work with you or find resources and people to work with for their end of life care. Anything else you'd like to share before we wrap up?
I think one of the things that is sort of implied in a lot of these conversations is the grief that comes from these journeys. There's anticipatory grief for patients, for families. There's the transition and the grief around those transitions of the actual dying process. And then there are the family providers who live afterward and who have to integrate that grief into their life. And and I think that it is largely implied in a lot of the services that are provided. It's offered, for example, by hospice, there's bereavement support. But I think that's one of the other things that we don't really talk enough about. Um,
Mhm,
there is not a great deal of grief literacy in our culture. There are more and more people who are exploring it, but I think there's still a sense of isolation and sometimes stigma that really challenge people. And not knowing where to go to get the right support, not knowing what the right support is, not even necessarily realizing what grief they might be experiencing or how it's manifesting. And one of the keys that we've noticed, and we actually wrote about this in a recently published journal article, is the importance of continuity of care. So
mhm,
in our team, the same doctor and doula provide the care prior to and leading up to an end of life transition are present whenever they're asked to be present and available during the transition, and then continue to provide care on an ongoing basis. And in my experience as one of the people who's provided that care, impact of knowing a person and their loved one intimately throughout the journey really positively impacts bereavement outcomes and the ability to deeply support people in their grief healing.
mhm,
And there's more and more information in Canada. They've done research that demonstrates that positive bereavement outcomes actually affect health outcomes. And so they've started to integrate bereavement care into their insurance model because good bereavement reduces the financial burden on society and healthcare. So this is something that is still, I think, a little bit shrouded in silence as well, and something that will need to have a bit more breathing room and expansive conversation and understanding. But I think that there's something really important about that as well.
Thank you for bringing that up. The grief aspect of it is really important, and just the idea of for the families and for the person who is dying, who are all in grief over it to have to make decisions, to have to, you know, form, formulate plans of action. There's so, you've pointed to something really important and the need and level of support and recognition of that grieving process, both before, during, and after. So
And that
that's
also links back to the very beginning of the conversation, which is how do we have these conversations? If
mm,
people plan ahead, if they talk about what they want with their loved ones, they will end up having conversations instead of crises. They will end up in those spaces knowing and understanding what's most important. And
mhm.
that will reduce the amount of stress and trauma that people might experience in trying to navigate those journeys. So it's a whole big circle, ultimately.
It is. Yes. Thank you both so much for being here and for the work that you do in the world. And yeah, we will continue this conversation because it's a big one. So
Yeah.
thank you
Thank you
both.
so much.
Thank you. Appreciate it.